My name is David Ikudayisi, a US board certified internist and regenerative medicine specialist. Welcome to Glory Wellness and Regenerative Center. We have offices and clinics in Tampa, Florida, USA, and Lekki, Lagos, Nigeria. At our centers, we use adult stem cell therapy and platelet-rich plasma therapy to treat and restore failing tissues and organs in the body to normal functioning state. I have been privileged to study from Russia to Paris to USA. And during this period, I've gained, vast knowledge in the field of regenerative medicine, in particular, adult stem cell therapy and platelet-rich plasma therapy. With this knowledge, our people here in Nigeria will be able to afford some procedures that maybe would have been very difficult for them to afford if they have to travel abroad. It is now known that Nigerians are traveling outside the country to receive some procedures that can be made available to them right home in Nigeria. I'm bringing this adult stem cell therapy that is clinically safe and platelet-rich plasma therapy to the people of Nigeria because Nigerians deserve the best medical treatment obtainable today anywhere in the world. And it's even best if this can be achieved right here in Nigeria. That's the major reason why I am bringing regenerative medicine to Nigeria. And I mean the adult stem cell therapy, the clinically safe one, and platelet-rich plasma therapy. A good example is a young kid, 15-year-old, that was, paralyzed after having neck injury, and he was unable to move his both hands and legs. But after having adult stem cell therapy, he's now able to move the upper hands, and it has already started even moving the waistline. So regeneration of his nerves have already started. We have not reached the point where he can move his leg yet, but at least what normally in orthodox medicine is being considered impossible is already being possible, and right on the soil of Nigeria. Therefore, we are looking forward to seeing you at one of our centers. Thank you. Good afternoon to those that are in Europe or America, and good evening to the attendees in Nigeria. As you already know, I'm Dr. David Ikudayisi, and I'm glad to be having all of you this evening online to learn more about regenerative medicine, which is gaining popularity both in Europe and Africa as well. It is becoming the hope of medicine. I'm going to try and share my PowerPoint slides with you so that you can follow with me. Please bear with me while I quickly do this. Okay, almost there. I have to redo it. Just a second, please. My life. Okay. Sorry for the technical issues. Share. Let me see if I can. All right. I think we should be good now. Sorry about that. I'll make this quick for those that may be interested in my background. Um, of course, I was born in Nigeria. I did my secondary school at Federal Government College Idoani, then later on got admission to University of Ibadan on merit to study medicine. And then within a year, the president then closed down UI indefinitely. So I won a scholarship to study abroad through the Bureau for External Affairs. And I ended up in Soviet Union, which is now Russia. So I learned the language, entered medical school. When I completed my medical education in 1996, I now decided to cross over to USA to further my education. So in US, I did my residency in primary care, internal medicine, and also after 3 years of completing that, I did fellowship training in geriatrics, and I'm a US board certified internist or internal medicine physician. So that is all about me. Now let us start about why we are all here. Regenerative medicine. That has been my passion. And the question now is, what are the goals for this evening? I will try and create awareness about regenerative medicine, explain what adult stem cell therapy and platelet plasma therapy is for those that may not, be familiar yet with this area of medicine. And also, what I'm going to be talking about is totally different from the double stem cell powder or the STC 30 tablets. So I don't deal with that. That is not what this is all about. I'm going to explain to you why adult stem cell therapy is safe and also some areas of it that are still in research. And the good news, for if there's anyone who has attended this webinar before or who has had the treatment done before, the good news is that we've been able to achieve some deals with our suppliers, not 100% all of them, but most of them. So the treatment is even going to be more affordable than before. Hopefully we can even get it lower in future. But at least where we are today is better than where we are some years ago. Also, do we learn from this presentation what are the conditions that are treatable in the clinical settings? One thing I will stress out throughout this presentation is that the earlier one seeks treatment using regenerative medicine, the higher the success rate, the less the number of treatment sessions that will be needed, and of course, the less expensive it becomes. We are not promising cure. I am not promising cure. You will see some testimonial that looks like cure. We do not, and I do not promise cure. What
we promise is incremental improvement, especially when the treatment sessions are being repeated. So you get additive effect. So please let us keep that in mind. Before I start talking about regenerative medicine, I want you to know other services that are available at our center in Lekki, Lagos, Nigeria. We have weight loss program. We have shockwave therapy. We do cosmetic medicine. We also do primary care as well as regenerative medicine, which is why we are all here today. Shockwave therapy uses sound wave, to help to repair any damaged part of the body. You can use it for pain in the back, in the neck, in the legs, and it's also very good for male and female sexual dysfunction. So this is all available, and we use the Swedish um, technology because there's Korean there and other stuff. I mentioned we do cosmetic medicine. So whether it is filler to adjust the shape of the face, or people that want wrinkles removed, it's not only women that wants to look younger and beautiful. Men too wants to look more handsome. So this is one of my patients I treated. Just letting you know that Botox is not for only women. Men can benefit. After this, anybody wants to learn more, this is the website. If you're in Nigeria, you can just add NG after Glory Wellness before the .com, and you can read more about on our website. Now let's get started. Thanks for your patience. I'm going to start talking about regenerative medicine now. Regenerative medicine happens to be, a relatively new field of medicine that has been in existence now for over 20 years. And it is the process of replacing or regenerating the human cells or tissues to restore or establish normal function states. So this also comprise, before I go into that, I like to mention the way Mayo Clinic defines regenerative medicine. They said it is a game-changing area of medicine that has potential to fully heal damaged tissues. But the interesting part is it is offering solutions and hope for people who have conditions that today are beyond repair. Mind you, regenerative medicine is not the answer to everything, but most conditions that Orthodox said there's something we can do, regenerative medicine says there may be hope. And regenerative medicine comprises of platelet-rich plasma, which I'm going to be referring to as PRP, and that is when you use your own blood. There's also exosomes. These are tiny particles. We get it from umbilical cord, placenta, or bone marrow. And of course, the popular part of it is the stem cell therapy. The stem cell therapy is divided into three sections: embryonic, induced pluripotent, and adult stem cell therapy. I will start with embryonic stem cells. This has some controversial issues. Why? Because it involves the use of embryos, which are potential human beings, and most of the embryos are donated by the IVF clinics. So some religious groups are against it, some countries are against it because you are using potential human being. The number two of the three types of the stem cell is induced pluripotent stem cells. This is when the scientists start reprogramming the adult cells to express characteristics that are similar to embryonic stem cells, and this is in research stage. This involves manipulating the cells, culture expanding it, reprogramming it. It can take anywhere from 6 weeks to 12 weeks from taking the cells, manipulating it, to the time it is ready to give to the patient before it is transplanted to the patient. So this is still in research stage. What I do, What I do is adult stem cell therapy. That's one that is clinically safe. It is the same day procedure. I don't expand, culture, reprogram. What I get is what I give back to the patient. And the word adult is not about age. It is about, fully formed human. That is why umbilical cord stem cell is under adult stem cell therapy. So we're going to be talking about three things this evening. The first one is platelet-rich plasma, then exosomes, then adult stem cell therapy. I will share some testimonial under each of these sections, and after that, we'll go into question and answers. So platelet-rich plasma therapy, also known as PRP, that is when you draw the patient's blood, we process it, we spin it, we get the yellow section called plasma, we get a section of that is very rich in growth factors, very rich in platelets, and those platelets contain growth factors and cytokines. We inject it to where we need it, and then the tissue in that area multiplies, they regenerate, and then we get healthy tissue that is permanent and is widely used in USA and is very popular too now in Nigeria. You can use it for cosmetic reasons, like get rid of wrinkles on the face, looking younger, sexual function in women. It works very, very well, even better, faster in women than men's erectile dysfunction. That is, all short, most women don't just need only one treatment session. Men may need more than one treatment section. It can be used for regrowing your hair, a wound that will not heal, or pain in joints. Like you can see the right corner, there is Kim Kardashian when she had vampire facial or PRP facial. You can see how it's injected into the scalp, into the joints. All these are evidence-based medicine. Some of your physicians may not know about this. They might tell you, oh, it is in research stage. Oh, it is not yet available. I already explained to you that there are different types. Some are available clinically, some are in research stage, and you can read more about it on the US website, National Institute of Health. This is a patient I treated in Nigeria about 3 years ago. The wound will not heal for 1 year. I used the patient's blood and the stem cell from his fat, and that is all I did. No special dressing, no special toning. You can see within 6 days, there's improvement. It's already, healing. By day 65, it has healed. I wrote an article about it. I submitted it. It was accepted into the Journal of Medical Cases. It was published in 2018, and then that's my name highlighted in yellow. You can use it for acne, like you see this lady. You can use for Yaiko style, or whatever the reason is why the woman is losing their hair, you can use it also in men. You can use for joint pain. And actually, this is 87-year lady that I treated over 4 years ago. She came to me in wheelchair, and then within 3 months, when I went back to Nigeria, because I go every 3 months, the lady that came in wheelchair walked to the clinic, did not use a walker, did not use a cane, and she walked herself. And then this is a testimonial from one of the children who sent me a text that how they appreciated the change in their mother. It can also be used for sexual function, like premature ejaculation. This is a gentleman who did not tell his wife, but he responded that things are getting better. Let me see. He said things are getting better. He couldn't talk because his wife, was around. Then even after that testimonial, about 7 months later, he texted me from nowhere that, he's happy, enjoying his relationship with his wife in the bedroom. This is a patient with testicular pain and also testicular atrophy. The left testicles was small, shrunk. You can see that actually down here. You can see the right, and then this is the left, and this is also the left. And then about 1.5 years later, you can see how the left has increased in size, and almost the same thing, with the right testicles. And of course, the testicular pain, went away. That is all about PRP. And then before I go further, PRP therapy is for anything that you can touch, um, whether it's your knee, your joint, your head, your face. Whereas exosomes and stem cell is for both areas you can touch and areas that you cannot touch. For example, you cannot touch your lungs. So if somebody has a lung problem, you can use you cannot use PRP. You have to use exosomes or stem cells. If it's your brain, you can't touch it. So for you to have an idea of what you can use for what. Okay. Exosomes are nano-sized vesicles. They are very small, smaller than viruses. They are section of the cells that are being secreted, and they contain the messages. That is the mRNA, messenger RNA. The exosome do not contain any DNA. The DNA are inside the nucleus. So with this messenger RNA that carries all the information needed to where you put them, they tell the area to start repairing, regenerating. So that is how they work. And you can get them from placenta, you can get them from bone marrow. This is somebody that had a second degree skin burn, although it looks light skin, but he has skin type 6, which is the same thing. We in Africa, our skin type is type 6. You cannot have a second degree burn and not be left with scar. You can see for yourself, there's no scarring, there's no abnormal pigmentation by 30 days after the treatment with exosomes. This is another injury treated with exosomes. You can see the perforation of the left eardrum with cutting board accidentally. Down here, you can see the injury, the injury that was done. And then the treatment was done within 3 days of the injury. Normally, it takes up to 6 months, on average, maybe 3, 4 to heal. This injury closed in 3 weeks. The video otoscope was done 4 weeks later, but clinically, the stopping of the drainage from the hair all stopped in 3 weeks. And then about 11 months later, you can see how clear, the eardrum is. So the left side is before the treatment, after the injury, on the left upper corner of your screen. 3, 4 weeks later is the left lower corner of the screen. Now, on the right side of the screen, you can see how everything healed back to normal. The the membrane in the hair is very transparent. There's no scar. There's no sign of any trauma. So that's the power of regenerative medicine. Exosomes has also been used in some people with diabetics. One of my patients in Abuja was treated in October 2018. 2 months later, the hemoglobin A1C dropped from 10.5 to 6.52. Another type of exosome is also being used currently to treat COVID-19. In USA, there's one particular exosome that is already in phase 3 trial, and that cure people that have COVID-19 on ventilator that probably would have died without the exosomes. So that is something that will also become available in Nigeria soon, once we have the clearance from FDA here and then NAFDA. So there's a lot that regenerative medicine can offer. This is a patient that the mother brought this 3.5-year-old boy to me in March to treat on March 25, 2021 this year. So 16 days later, I followed up to find out how they are doing. So I'm not sure, depending on whether you are using your phone or laptop, I'm going to read, the response from the mother when I ask for an update. He said, since the son got his treatment, that I noticed changes in his behavior. So she went further to text. I read, he is more calm and willing to listen. He is better with his emotions now. He hugs his little brother good morning. He has never done that. His speech therapist said he has better understanding and he is trying to make sounds that sounded like words. He was able to match puzzles all by himself without any help. I hope to see more progress. We are definitely coming back for more. Oh, by the way, I also treated the mother with PRP for O short, simply because autistic child is not an easy one to take care of. So she has lost interest, in sexual relationship with her partner, with her husband. So she complained to me. She found out about O short. So since she flew down from another state, we decided to treat her. And then she said that about the O short, I noticed more lubrication and no more pain with sex. I now have urge and desire to have sex. The orgasm is more intense too. I feel less stressed. Thank you very much. So this just to tell you that if there's anybody that is on listening and they have issues, they can't even tell their husband what is going on, osteotherapy may help. Now, using exosomes for this autistic child, 3.5 years old, that we've been talking about, there's a continual improvement. So what happened was that I sent a text yesterday, May 8th, to find out if there's any further improvement. If you pay attention, the time there is 4:40 p.m. US time, and down here is 11:18 p.m. when she responded. And I'm going to read the important part. So this section here from green to here, green is what I'm going to be reading. And I think it's more visible on the right side of the screen because I kind of type it out, So the response is this what she typed. I am glad to see him make so much progress, though he is not there yet, but I am happy with the result, period. I noticed he is trying to say some words, though it does not come out right, but at least he is trying. That it does not do before. Now he can pronounce at least 15 alphabet sounds and something that sounds like bread, shoe, yellow, green, red, blue. Before, you can never get, his name is out, you can never get him to repeat or pronounce anything. So within 1.5 months, in a child that has been stressed in mother heart, I believe this is why Mayo Clinic said that regenerative medicine is the field of medicine that is giving hope for conditions that orthodox medicine says, sorry, just deal with it. So that's a great improvement. Now, the last part of the presentation, adult stem cell therapy. And I will try, I think there's a lot of information that this section, I will try and move fast, so that we can get to question and answer. First of all, we need to understand this slide about stem cells. If there's anything you're going to remember, if it's just this slide, then you know about stem cells. Stem cell is a cell that can multiply, renew itself, and at one point can differentiate into matured cells. That is the basic understanding of stem cells. That is why all of us online, listening and me talking, we all came from one stem cell, sperm and ovum. The sperm fertilized the ovum, then from that complete cell, we are created. So stem cell can differentiate into, any organ, which we already know anyway. We already know about this before, there are three types. Only adult stem cell is clinically safe. That's the only one that I'm involved with. That's the only one that we're going to be talking about. And it is outpatient. I don't coach, I don't manipulate the stem cells. You can get this stem cell from the bone marrow. You can get it from the fat in the stomach. And you can also get it from umbilical cord. That is why in Western world, any newly born baby, they collect the sample of the umbilical cord. They ask the mother for the permission so that 25, 30 years later, if there's a problem with that child, you can use that child's own umbilical cord blood. Then, and this time you have to culture expand it. Then you have to multiply it so that you can reuse it. Otherwise, if any of us listening wants umbilical cord blood, you can either get it from a relative, who is about to give birth, or you get it from ready-made, you get a ready-made umbilical cord stem cells. There are companies, FDA approved tissue banks in America that collect umbilical cord blood, test the mother, test the blood, and then have it ready for anybody that needs it. And mind you, you do not need to do blood group typing. You don't need to cross match. As an adult, for me to give you my blood, I have to make sure that we are compatible. With umbilical cord stem cells, you don't. They are primitive. They do not trigger any immune reaction, and therefore anybody can take it without needing any blood type or cross matching. So, how do these stem cells work? I know you're wondering, okay, you can do this, you can do that. How do they work? Yes, it's not very complex. When you transplant the stem cells into the body, they flow around, they go from head to toe, anywhere blood supply reaches. And if they identify any area of damage, injury in the body, they tell that part of your body to start repairing itself. So that's why they call it paracrine effect, cell-to-cell communication. So they create an environment that will now make the damage or the dying cells to survive. So they kind of help the body to revive and stop the cell from dying. They're also very good in modulating our immune system. That is why they are good for COVID-19. Because COVID-19 virus triggered the body to cause some blood clotting process, and the body attack itself. The immune system become messed up, but exosomes or umbilical cord stem cells will turn around, modulate immune system, regulate it, and then that's why people are able to come off the ventilators. And also, I know I mentioned exosome before, but FDA too has also approved umbilical cord stem cell to be used in treatment of COVID-19, but this is still in clinical trials. So they approved the research to be done because of the potential benefit. So it's not something you can just get. Of course, if you are getting umbilical cord stem cells, yes, it boosts your immune system, but we cannot quote unquote say that we are treating COVID yet until the FDA, gives it final approval. Although it's just giving final approval, the process is still the same. It's still the same exosomes or umbilical cord that they are using. Oh, this release, they also used, stem cell. That was in April 2020. This was published April last year, and they had a 100% success rate. In all their 6 critically healed patients that they were sick because of COVID-19. All of them survived. So that's the power of regenerative medicine. Now, some of you might have heard the word of autologous and allogenic. Autologous simply means something taken from you and given back to you, from you to you. It is the safest form of transplantation, and the Jehovah Witness, they don't take blood from anybody. They use their own blood anyway. So the risk of rejection is 0. But not all conditions can be treated with autologous specimen. For example, sickle cell disease, you cannot use your own stem cells or bone marrow or umbilical cord. You have to find a donor, or leukemia. So in that case, when you are getting from someone else and it's not yours, it is called allogenic. Of course, compatibility has to be also, addressed. So how do we get the fat? People are wondering, is it safe? I do the harvesting by, in the area, collect the fat that I need. The patient is awake. I don't like putting patient to sleep, except if they are children. For example, when we were doing one of the Nigerian governor's kids that are treated for cerebral palsy, we have to put him to sleep. He's 9-year-old. You do not want to traumatize a kid remembering what you're doing. But for adults, you are awake, we chat, no intubation, so the risk of, will I survive, all those things, we take away all those fear or those phobia, okay? So, and it's just 1 hour and I'm done. The main work is in the processing of the stem cells. It can take up to 6 hours harvesting the stem cells, whether it is single or double or triple dose, depending on how many areas of the body you want the stem cell to reach, or multiple medical conditions that you may have. That may require that you do triple dose or double. Most people like double anyway. Most of the testimonials, especially diabetics, they did double. And then at the end of those 7-8 hours, all I'm getting is this tiny stuff. These are vascular fraction. They contain the stem cells, and we give it back to you. Depending on what you are treating, the treatment may be 5 minutes. It may be additional 2 hours. So that's how we do the stem cell. The bone marrow is the same too. On my social media, I think there's a post of one lady. She didn't feel anything. Of course, we numb it. We go in, harvest the bone marrow, we process it, and then we put it, we transport it to where we need it. So what can be treated? Pretty much any degeneration. Not all diseases are degenerative disease, but anyway there's degeneration, regenerative medicine can be used to regenerate that tissue. And there's limitations. So it's not the answer to everything, although it is answer to most things. So now it's making incurable disease to become treatable. Remember, I don't like using the word cure, or those of us in regenerative medicine don't like saying that. I'm almost getting to testimony and we are done. But I just want to point out, if there's a problem with the brain, the spinal cord, or the kidney, unless they are acute, maybe somebody just have kidney function was good last month, and all of a sudden something went wrong, either from medication or infection or whatever, and they have acute kidney failure or acute stroke, or they just have an accident, they become paralyzed. Or if it is acute, you can get away with 1 or 2 treatments. Otherwise, kidney disease and spinal cord injury, old stroke, they need multiple treatment sessions. And then the patient will have to be patient. In the one of probably the last video, there's a kid that you will see, 2 years old injury. It took 9 months to get the right hand to move. It took 12 months to get the left hand to move. And we're doing the treatment every 3 months. And then it will become really expensive. So please keep that in mind. These are just some conditions that can be treated. There are so many. Autoimmune disorder, rheumatoid arthritis, Crohn's disease, lupus, autism. People are just tired, fibromyalgia, multiple sclerosis. There's a video of a patient treated in November. I'm not showing it here, but it's on our Instagram, for multiple sclerosis, and she's getting a lot of improvement, Diabetics, type 1 is mainly autoimmune, but type 2 could be because of overweight. So you can use stem cell for that. People's blood pressure become controlled. If somebody has stroke and it is acute, 1 treatment, great result. Cerebral palsy, it can help. You will need more than 1 treatment. Erectile dysfunction, and my Caucasian patients, they need only 1 treatment. My African patients, they need up to 3. Some people 2. Or if they do 1, it takes like 6 months to 8 months to see results, whereas my Caucasian patients within 3 months. And we've tried to figure out why. None of the doctors can give an answer. I don't know, maybe our expectation in Africa is higher. For female infertility, there are people who have tried IVF. They 3-4 times, it's not successful. They try stem cell treatment, adult stem cell, boom, there's improvement. Or stem cell therapy too can even help the success rate of IVF to increase. So there's also hope in that aspect. Arthritis is common. We see some testimonial. Some people want treatment, some people need more than 1. Neck pain, back pain, spinal cord injury, developmental disorders. There's a kid from Canada that was 6-year-old, brought down, was diagnosed with Dravet syndrome in Canada. Within, I believe, roughly 4 weeks, the mother is already happy, even trying to talk, respond more to the name and calling her name. I don't have it in the air, but my point is there are so many testimonies. I've been doing this for many years. Even if you have nothing wrong with you, we're all going to die one day. Sometimes it helps to rejuvenate your memory, your energy, your sleeping pattern. So that's why we use it for anti-aging as well. We've been talking about sexual function enhancement for spouses to preserve marriages so that husband don't worry about the wife or the wife don't worry about the husband, any one of them being enticed to people they shouldn't. So it does preserve marriages, it can restore relationship. All right, so the presentation is over. Right now, I'm just going to see if I can go over the testimonials, and then we can go into question and answer. This is a kid I treated with umbilical stem cells, son of a 9-year-old boy, autistic child, treated in 2019. The father is a orthopedic surgeon in Nigeria. And then within 5 days, he sent me a text that he's participating more in family activities. And then within, let me say, 3 weeks, he's able to play piano, self-taught. And then by January 14, they sent me a text that he obeys instructions better, he has less tantrum, but he's still repeating words. And then the following month, February 8th, he said that, okay, now he's improving, not when he does repeat the words, but he had response. In other words, when you ask him, how are you before, he will repeat to you, how are you? Then by February 8th, the father said, he will now say, how are you? I am fine. So that's an autistic child I was treated with umbilical cord. The first one I told you that I treated on March 25, 2021, we use exosomes, for that. So depending on which one you use, all of them will still give you some benefit. This is a patient with arthritis. You can see bone on bone there on the right side of the screen. Offered surgery, did not want surgery, came to Nigeria to see if I could put. Well, she came to US. They offered surgery bone on bone. She said no. She said she wanted to try something else. So we did FAT and PRP for her, and then within 11 days, the pain level has dropped from 7/10 on the left to 4, and then 6/10 on the right to 3, and then 5 weeks later, it has dropped down to 3/10 and 2/10. This is somewhere, I would think, 80-something-year-old lady, treated also January last year with 11 years of hip pain. And, she used to say that she went to, I think, her property step on something in Africa, and then since then she's been having pain. But we were able to treat her to 11 years later, and then 2 days after, when I follow up to see how she's doing, she said, I have not experienced any pain since the adult fat-derived stem cell. And it has really helped me, So the pain does not relapse. I thank God. So, and then I think I treated in January, in July 23rd, which will be 6 months later, the blood sugar has gone down to 96, the fingers blood sugar, and then the blood pressure has gone down to 136/80 at that time. So, and then the hemoglobin A1C2 dropped to 6.52. So, that's another happy patient. This is a patient that has surgery in the neck, as you can see, was treated with, I believe this was triple dose treatment that he had. 2 days later, he said, I feel amazing, no pain, the pain is gone. Then started referring his architect, his lawyer. So, and then wrote me all this long stuff, craving stuff, depression gone, hair growth, notice, sexual function, memory, all those stuff. And then he said that there's no side effect, he's happy, no headache. So it's good to have a happy patient, but mind you, everyone responds differently. Not everyone will get exactly this kind of result. Some will take longer, some will take repeat sessions. So please keep that in mind. This is somebody who has kidney problem, diabetics, high blood pressure, got double dose of fat. The next day was able to read his newspaper without glasses. The stool improved, the blood pressure became fantastic after being on dialysis after erratic high blood pressure for 15 years. And then by 5 months, he said that he has to even skip some of the drugs so that the blood pressure and the sugar does not become too low, as he was recording 90/50 for the blood pressure. And then he stopped blood transfusion, and then the epogen was also stopped. Oh, and then he said his sexual function improved. This is acute stroke, double dose fat. This is one of our federal government minister. Of course, I can't tell you the name. And this treatment was done in 2018, 3 years ago. Within 2 months, the hemoglobin A1C dropped down. But that's not why the patient came to me. The patient came to me because of acute stroke, 3 weeks old. Within 14 hours, half of the symptom gone. I came back to Nigeria 3 months later. It feels great. He said he had turbo energy. This is just to tell you that no, you don't have to do double dose. You can do single dose. All of you will get to your destination. It's just that it takes longer to when you do single dose. But if it's your wish, you can do double dose, and some people can even do triple dose. Okay, this is a patient that was treated on November 20 last year, 2020. That this is a patient you can see in 2019 and July had a knee replacement in US. They recommend hip replacement in US for both hips. She agreed for only the left side. So last year, January, the right side got worse, but I couldn't, because of COVID, I didn't go to Nigeria until November. So we treated her. And that's the first time we did bone marrow in combination with fat, in combination with PRP, in Nigeria. I call this kind of procedure Ferrari, I don't have Ferraris, okay? So, but I just like to use car because to compare. You're going with the best, you're going with fast car, you're going to get there faster than somebody driving Toyota Corolla. But all of you get to your destination. So what happened is that the pain that was 9/10, within 2 days, 48 hours, dropped down to 3/10 in the hip. But 9/10 in the knee dropped down to 5. So 3 weeks later, what has dropped from 9/10 to 3 further dropped down to 2, and the knee that was 5 further dropped down to 2. Then 51 days later, he said everything dropped down to 1. And recently, when I followed up with her, she said she's still regenerating, and the pain is still around 1, sometimes less, and occasionally it maybe go up to 2. But again, the goal of this kind of treatment is 50%, although she's having like 80% reduction. It will not be typical for everybody. Mind you, she did the so-called Ferrari. So if you just do ordinary blood, you get your 50% by 3 months to 6 months. It may not be 48 hours like this lady. Okay. This is somebody also that 75-year-old that could not stand straight. 2 days later, can stand straight. And I think this is probably second to the last slide and video. I'm going to play it. I will fast forward it because there's a section I want you to see there. She has severe back pain. She cannot walk straight. She needed a cane. And then you will see what happened. That's the damage in the back. This is in the evening of the evening of So then later on, she said she was able to sleep very well. She felt better after the therapy. She was able to walk upright, Then 3 days later, I asked her how she was doing. Let's see. I want to fast forward that. And then she said there's no more pain, from my low back, just little pain from the right hip. And then my inability to walk in upright position has improved, but bending has tremendously improved. Now, yes, this is where I want you to watch. Look at that. Look at the angle. Let me go back. You see the angle where she stood up? She on her own just took that video and sent to me 3 months later from Nigeria. So that is the power of regenerative medicine. Okay, this is the last video and we're done. This is the kid I was talking about in my introductory video, who was playing in secondary school and wrestling. They had his head upside down, smacked it on the floor. So he had emergency decompression surgery done and scar tissue was formed. After that, of course, when the wound healed, I didn't get involved until 2 years later. So it took time to get a result. But remember, like I said, the earlier one intervene, the better. So let's see what we have. 24 hours later, it could, okay, just a second. So 24 hours later, it was able to move his hand a little bit. That is what is shaking in this video here, okay? This. But months after, it took 9 months to have the right hand up, 12 months to leave the left hand. And then I'm going to fast forward it to, let's see. Okay, as time goes on, he was able to raise the hand above his head. The speed at which he was able to move the left hand too increased. You see him there doing better. And then by 15 months, when you turn him, he's able to turn himself back. Mind you, this is somebody that was paralyzed from neck down. That is no movement in the shoulder, in the waist. Because in medicine, something like this, more than 15 months, they tell us that there's nothing you can do. But as you can see, regenerative medicine says that there may still be hope. The only unfortunate thing in this situation is that the treatment was not sought for within the acute stage. Like the federal government minister that had a stroke for 3 weeks, he had only one treatment. He's looking younger. That was in his first term in office. He's in the second term in office now, energized, and everything is great for him. This boy could have been able to walk in less than 2 years if the treatment was done within 6 weeks. But unfortunately, that's not the case. So what I'm just trying to say is that the earlier, the better. Oh, sorry, I forgot there's one more patient. This is a patient with acute. We treated this patient in September 2020, last year. Patient had a stroke on Sunday, unable to move the right side of the body, unable to speak. When we were contacted for consultation, we went in to treat the patient. And then that was on Friday. On Saturday, patient started speaking. So it happened on September, the treatment was done on September 11. You can see she cannot move the right side. Now, the next day, September 12th, you can already see the gradual improvement following a transplantation of one of our regenerative medicine procedure. And then I'm going to let you watch this through. So after this, we're done. You can see little movement in the leg. Day 3, she's already able to move her leg better. Mind you, we still recommended physical therapy. This is one of the physical therapists, working with her 24 days later. Of course, the therapists appreciate the application of regenerative medicine because it offers accelerated healing process. And then by 30 days, she's already able to walk without a cane, And then by day 53, You can see our walking is even better. From somebody who could not talk, who could not move the right side of the body, you know. So the body will still going to heal, but regenerative medicine helps him to go back to complete state or restore normal functioning state, which was the definition given of regenerative medicine at the beginning of this presentation. So in summary, um, we can use PRP to treat any condition that can be touched, or we use exosomes and adult stem cells to treat both what you can touch and what you cannot touch. So I hope I've been able to explain to you that this is something that is safe. And again, you have to seek treatment. The earlier, the better. We do not promise cure. You might have seen some things that look like cure. We don't promise cure. Those that have children or family members that have sickle cell disease, we currently do not treat that, but we are working on it already so that in less than a couple of years, we'll be able to offer that treatment in Nigeria, and you don't have to travel outside. And most importantly, some of these procedures are hugely discounted. For our fat-derived adult stem cells, everything is almost 50%. That is the, of course, somebody doing triple dose 3 years ago compared to somebody who will be doing triple dose now, they paid exactly twice the price. Likewise, double dose and single dose. And this is thanks to our supplier. We're able to negotiate with them that we need help in Africa. We're not that buoyant, we're not that rich, you know. There's a particular supplier that is not budging, but we've been able to, for most of our suppliers, we've been able to reach an agreement whereby they are discounting anything that we want to take to Africa to help our citizens. So if you, that is the end of the presentation, and these are our contacts. Most of you already have it. So if you have any question, please send it in question and answers, and then we will address them. Thank you for your patience. Thank you for your time. And those that are in the Western world and that are mothers, happy Mother's Day. So now I think is the question and answer time. Okay, I see we have some questions.
Dr. David.
Okay, go ahead.
Yeah, thank you, Dr. David, for the presentation. Well done, sir. So we have some questions here. Well, for those that have not met me, I'm Dr. Kola Ole. So I'm sorry that I came in a bit late. Audible. Am I audible?
Yes, yes,
okay.
We can hear you.
All right, thank you. So the first question says that can stem cells be used to grow the right leg of a 4-year-old, which is 0.25 inches shorter than the left leg, causing the child to tiptoe? So can it work for limb length disparity?
Yes, that's an interesting question. From the way we do the treatment, we are not able to use it to increase the length of the section of the bone of the legs. So the simple answer to that will be no. By just injecting stem cell in the joint, that will not increase the length of the shorter leg.
Okay, thank you very much.
Thank you very much, sir.
So
Yes.
the next question is, can it be taken care of fibroid?
There is a Nigerian doctor who is actually a specialist in fibroid in Abuja, who US in the last 3 years have brought to America and is working on using adult stem cells, using stem cells to treat fibroid and as well as also perfect the treatment for fertility. So the way what is clinically available, which is the way what I practice now, we don't use it for fibroid. When the research is completed, then there'll be particular technique that will be released, which you can use to help people with fibroid.
Then the next question says, can it be used to regenerate the adult spine? Because the person says that they are of the opinion that adult spine does not regenerate. So are we able to use it to regenerate the adult spine?
Okay. When we talk of degenerative disc disease, which is what is common in the neck level, the thoracic level, and most common in the lumbar, the lower back. You can use either of the regenerative medicine procedures to treat the back. The arthritis or degeneration going on, most of them are caused by inflammation. There's a slide that I did not show, just to shorten the time. One of the way that regenerative medicine works is anti-inflammatory approach. That is how they work for arthritis. They reduce the inflammation, they reduce the degeneration. Some people, they have damaged meniscus or cartilage. When you inject any of the biologics, what they do is they tell the body to start repairing itself. The person that has the question that, okay, degeneration of the back doesn't regenerate, under normal condition, yes. Second to the last slide that I showed you, you don't see anybody that is paralyzed for 2 years. Half of the neck, spinal cord is cut. You don't see them coming back and move their hand. So before regenerative came in, that is the belief. That is why the definition of it by Mayo Clinic says offering solution and hope for conditions that we all thought is not possible. Like I said, it is not the answer to everything, okay? But just to let that person know, before that information is correct. But now, with the presence of regenerative medicine, it's no longer correct. I hope I satisfy the person's answer the person's question. Over to you.
The next question is, if it requires surgery, this process to treat diabetes.
You mean what I guess the person is talking about?
That is regenerative medicine for diabetes. Does it require any surgical intervention?
No. There are 3 ways it can be treated. The easiest on the doctor, the easiest for people that are concerned, have the fear of any, even if it is not invasive procedure of anything, is either we use by one of the 2 biologics, that is exosomes or umbilical cord stem cells. Both of them are already ready-made. FDA, US approved tissue bank companies produce them, we get them, and we give it to the clients. We transplant it intravenously. The simple way you get a drip, that's how you just transplant it. So there's nothing to fear about. But there's some people that says, for example, Jehovah Witness, they are not going to take blood more. I mean, I understand there are some changes, but at least before then, they will not take blood from anybody. So they won't use exosomes, they will not use umbilical cord. So the only option left is to do fat-derived stem cells. And I showed, maybe the question was asked before I got to how we do fat-derived stem cells. I don't cut. Yes, I show my cannula going into the patient to take out the fat. I make that hole with needle. Because I use the needle to make the hole, when I am done, I do not stitch because I didn't even cut to start with. So there's nothing to stitch. So, and that is why it is outpatient. Yeah, it may be a long day, 10 hours or whatever. The stress is more on me, the doctor, than on the patient. So when I'm done, the patient goes home. So no surgery. We call it minimally invasive. So I think that answers the question.
Um, well, how about the? I mean, just to for some. How about the option of which we have done here in Nigeria of interventional access? Facilitated by a radiologist.
Okay, yes. Thanks for bringing that up, Dr. Kolawole. You see, like I said, there are so many things that we've done. I can't bring everything up otherwise we're going to be here for long. We've done target organ delivery for diabetic patients. So what we did was that we, instead of transplanting the ready-made stem cells through the vein that will go all over the body before it gets to the pancreas that actually need it for a diabetic patient. So what we did was that we contacted a US trained intervention radiologist, and he gave us an access to the pancreas. They passed a wire, down the arteries. So we get to the arteries that supply the pancreas. Then we gave the biologics straight to the pancreas. Then after that, the rest of the body also got the stem cells. But the patient is concerned about diabetics. Pancreas is the organ related to that. So we made sure that pancreas got those stem cells first before the rest of the body. Otherwise, the simpler way is to transplant it through the vein, and then whatever you gave, go all over the body. Only fraction of it will get to the pancreas. So that even in that case, that is a little bit invasive because we are passing wire through the arteries, maybe through the groin, sometimes through the wrist. We don't keep patients overnight. The patients are being kept to prevent bleeding from the hole that the intervention radiologist made. And once the bleeding stops, then they go home. But still, there's no surgery, there's no cut, there's no opening of somebody's body. I hope that answered the question.
Thank you. So the other question, you mentioned it briefly, talking about the application of for fertility, that is using regenerative medicine for infertility. So this person is asking about PRP for fertility. So maybe we can just extend it to PRP and
Okay.
adult stem cells for fertility treatments. Maybe some more details on that.
All right. Remember when I said PRP is for what you can touch, exosomes and stem cells is for what you can touch and what you cannot touch. In case of infertility, if the problem has to do with maybe as a Asherman syndrome which is like scar tissue forming in the inside the womb, the uterus, or uh, the ovary is not producing enough eggs. Through some let me say okay, let's say through the vaginal canal, you can reach the wall of the womb, the wall of the uterus. You can inject PRP directly into the wall. You can also even do image guidance, like a sonogram. It will show you where the ovum, the ovary is. You can also, as long as you can see it, then with the needle, you can reach there are special needles. You can reach the ovary. So in those cases, you can use PRP. These are the only way of reaching the fertility organs using PRP. The other way is you can use exosomes or we call stem cells or stem cells from the fat. These are adult stem cells, which can also be done because you can reach and touch them locally, or you give to them as a drip. Or you can even reach those areas, by the target organ delivery that we spoke with using radiology interventionist. And these stem cells will bait, we go all over the womb and the ovary and everything, and they will stimulate the body to do what it's supposed to do under normal condition, help the body to regenerate, and then the person may even be able to conceive on their own without IVF. And if they still need IVF, the success rate will be way, way higher, almost close, 80, 90% than what it is that some people have been failing IVF 4 or 5 times. So yes, PRP can be used. Over to you.
Thank you. In fact, I think we should also, emphasize that it even is beneficial for male factor infertility. Or if our audience remembers the slide on the man that had shrunken testicles, one of the
Yes.
results we got was that his testosterone increased after that
That's
procedure.
Thank you for bringing that to the knowledge of the audience. There are so many things that regenerative medicine can cover. That's important. Thank you.
Yes, sir. So we've spoken about degenerative disc of the spine, but now let's talk about spondylosis. What the use of of these therapies for spondylosis, lumbar spondylosis, this person is asking about.
Okay. And things like lumbar spondylosis, degenerative disease, they all go together. These are all arthritis of the of the spine, and arthritis means inflammation of the bone, which of the joint. Of the joint, which can cause bony spur, bony outgrowth, and the bone will be reacting. It will grow, develop spur. The disc in between will be affected as well. The spines, in some cases, if it's severe, can become like a bamboo. You know how the bamboos are in sections, and they have their sections and their joints kind of growing outwards. So all these spondylosis, degenerative disease, they are still all under they are caused by arthritis, and most of the time with age. The cheapest way is PRP, but that will need more than 1 sessions. The next one is that umbilical cord, stem cells, exosomes, or fat alone, or you can even mix them with PRP. This will go further to significantly reduce the inflammation and make the body to start trying to normalize and degenerate so that the healing process will be better. So all this can be treated. And I believe I remember the lady that, let me see, so I can answer this person's, yeah, this lady. You know, the MRI, okay, sorry. The MRI, I summarized it here. In the full report of the MRI, she has, degenerative disc disease as well. She has narrowing of the low back, which is called stenosis. Let me see if I can. Yeah, you see all this? You see how the bone spurs are all showing? This all degenerative disease. You see the back there. I want to see if okay. Yes, I probably took out the real MRI details because it was probably too long. So this is a good example, and you'll see what happened 3 months later, how she was able to stand up. So the answer is, to make it, not to prolong the topic, the answer is yes, we can treat spondylosis, degenerative disc disease, stenosis. Oh, by the way, for stenosis, it does not, stenosis means narrowing of a space. Stem cell does not open up the bone. Bone is a hard structure. It is not going to make it open. But the tightness, the irritation, the inflammation caused by the stenosis, the stem cell treatment will modulate the body's response to those inflammation. And then the pain will either be reduced or gone. But it doesn't make a narrow spine to become widely open. No, it's not a surgical treatment. It just makes the person to be functional and then normalize the painful response back to non-painful. So over to you, Doc.
All right. Thank you, sir. So this question has been mentioned before about why stem cell therapy or regenerative medicine as a whole can address multiple problems. And that has been addressed. That was what this question is about. So the answer to that question, which says, do we have to get treated for one condition at a time, or do they benefit together? If the conditions, are the type that can benefit from stem cell therapy, they will benefit from just the single treatment.
Yes, so that is correct. To even, you see, we have patients that we treat for hair loss. We inject exosomes into the scalp. And this patient, we just come back, say, oh, about 3 days later, this swelling and pain at the back of my knee that I have for some years just disappeared. Even though we're injecting to the scalp, some of the exosomes or the umbilical cord will still leak into the circulatory system. And anywhere there's inflammation in the body, they travel there. Now, if you now even give it into the vein, stem cell therapy does not know why your doctor is giving the treatment. They travel all over the body and they fix the problem. The exosome that was used in the left eardrum perforation, it wasn't injected into the eardrum. It was injected into the vein. So anywhere blood supply reaches, stem cell therapy will reach there. It's just like medication too. If you're going to give somebody antibiotic for the wound in their leg and give them tablets, it's the same tablet you're probably going to give for the wound in their shoulder. The body is going to absorb the antibiotic. The antibiotic will travel all over the body, find the area of infection, and heal the infection of the skin. So that's how it works. Stem cell goes everywhere and take care of problem. Over to you.
Yeah, so for the questions that we've answered, I won't repeat, but for those that are asking about cost of treatment and how to get more information, please, our contact has been displayed. It will be displayed later on again. Contact us in the clinic. You can come in to have a chat with us in the live. You will not need to pay for that conversation to understand more. So cost of treatment depends on what we are treating. There's because as I've heard today, there are several options. So all those options will be put on the table, and then we can make a joint decision between that is yourself and ourselves, and then that will determine the final cost. So just for our information. So I'll go to the next question that we need to answer.
And let me just quickly clarify that I'm going to be in Nigeria in less than 2 weeks' time. Like doctor said, you can come in for free and do inquiry with the doctor. If you want consultation with him and you want to register, of course, that is will be a fee. But for me, with me, I have so many procedure lined up. I am not available for any free consultation because I have patients that have been waiting for me because of COVID. So if anybody, we have a fee for registration, we do have a fee for consultation, so that you don't misunderstand what the doctor said, so that you don't get mad or say somebody lied to you. No, with me, there's no free consultation. My time is very, very important. I need to treat patients, so I can't be doing free consultation for everybody that's interested. We have a lot of information on website. Come chat with the doctor, and we answer your questions. And if you not decide to do consultation, please, I will make time. I'll be available. I just want to clear that. Thank you. Over to you, Doc.
Yes, well, someone asked a question, and let me just answer that quickly. That for those that cannot come in, can call us, we'll speak with you. As doctor has said, it will be myself. It will be free. It will be myself that will speak with you to talk with him. That's when there has to be a paid registration and consultation to discuss with him. So that, but we are available. If you can't come in, call us. It can even be a video call. Take it.
And telemedicine too, yeah. So if there's telemedicine for consultations, if somebody, let's say they're outside Lagos, because while I'm in America here, I'm already doing consultation. There's what they call telehealth or telemedicine. So which means we do consultation by the video. And then by that time, when I see you, we continue the consultation in person. I just want to add that. Go ahead, Doc.
Yeah, so this person is asking about their 75-year-old mom with arthritis. We have said that we can treat arthritis, but I guess the age is what is concerned about. You have seen the testimonial about the 80-something-year-old woman. In fact, if anything, people that cannot go for surgery because they are very old, this is an option.
That's right.
A better option for them. So that's the answer to that question. We've answered about sickle cell disease. We've spoken about kidney regeneration. Okay, and then this person is asking about menopausal problems in women.
Menopausal, okay. There is, remember I mentioned that US took a doctor from Abuja who specializes in fibroid to be doing studies in the US. In about 3 years ago, they came back to Nigeria to make a presentation whereby they put rats into menopause, they sterilize them, and then later on, they use bone marrow stem cell to see if they can reverse. The rats not only made beautiful eggs, they not only made new eggs, they made eggs that are even better than before they were sterilized. And then, of course, the rat gave back to, I think, 4 baby rats. He did the video. He came to National Hospital in Abuja. He made presentation. is a friend, that I know. While we were there in Abuja, he got a phone call from US because they've gone from the rat level to human level. They are doing research with bone marrow for either premature menopause, and what they found out is what happened then is that three of the women that paid for the trial, because it was self-funded and extremely expensive, I guess they wanted their own babies. Three paid. One of them has been in menopause for 11 years. I think it was in July that I was in Nigeria with him, and they treated this lady December prior to that. So about 7 months later, she started menstruating after 11 years. 7 months after the treatment, but 11 years of menopause. So there are some things that are in research, but though this treatment was target treatment, it wasn't intravenous. If can intravenous do that? Maybe, but you may have to do more than one session. Remember, when you give it through the vein, only little get to where you need it. The studies being done is target organ delivery. So, somebody might have written about the bringing menopause, bringing menstruation back through the vein. But with my knowledge, with the little that I know, that will probably need more than one treatment session because only little is getting to the where you need it at a time. You have to do target organ. So the summary is yes, it's doable and it's being done.
I think a follow-up question to that is, so we've just spoken about abnormal menopause, people that attain menopause prematurely before completing their, desired reproductive potential. But what about normal menopause, people that are already old in menopause, but the effects of menopause, hot flushes, dry vagina, those anxiety, so those problems that come with for women that are in normal menopause, how can they benefit from this therapy?
This one will benefit from simple intravenous because people that are in menopause that have been treated for diabetes, one thing or the other, they feel better generally. That's the report from them. But for the dryness part of the menopause symptoms, for the dryness part, you have to do O-shot therapy. You have to inject into the part of the private part that lubricates the vagina area. If I posted, I think probably about a month now, O-shot testimonial on our social media platform, Facebook, Instagram. The lady is so lubricated that, she's happy. And at the follow-up, which I have the video not posted yet, he said, she's really well lubricated, very, very 100% is what she keeps saying. So the dryness using ordinary blood, which is the cheapest, can be, restored. So there's no pain during intercourse. And then those that were using estrogen cream because of dryness, they stop using estrogen cream because there's no need for it anymore. So the symptoms of menopause can be addressed, yes.
The next question is how this can help with cancer treatment.
With cancer treatment, okay. And I think also there may be a couple of people raising their hands so that I don't know if you're able to see that, so that they don't feel neglected. As far as the cancer treatment is concerned, currently the treatments are in research stages. At our center, we do not treat cancer yet. I use the word yet because 2 years ago, I was going to bring the cancer treatment to Nigeria using stem cell from the fat because there are three countries, UK, Germany, and US, that were doing research using your fat to treat solid cancer and even the cancer that has traveled. Technically, even though I don't like using the word cure, but technically making it cancer to disappear. To do this, you need a particular vaccine. And only US and Germany produce that vaccine that the company is using. So they promised me blueprint, but I must provide the type of vaccine that you can get in Nigeria. And of course, me and Dr. Kolawole, we went to National Institute of Medical Research, NIMA, in Yaba. We met with the DG, we tried everything. I made all the right connections, but unfortunately, Nigeria does not have the vaccine. So without the vaccine, even though we're already doing fat-derived stem cells, without the vaccine to carry the stem cell to kill the cancer cells, we can't go any further. So that's why I said not yet, because there may be hope in future. And once this research is approved in UK, Germany, and US, of course, people can travel to those places and get it. Over to you.
All right. So the next question, we've spoken about it briefly, but so how does let's asking about infertility, regenerative medicine versus IVF. So what's the answer to that?
Okay. It depends on also the cause. Regenerative medicine can help almost in all situations of IVF, but there are some physical issues that regenerative medicine cannot help. If somebody has a closed fallopian tube, preventing the eggs from migrating into the uterus, there's no amount of regenerative medicine treatment you get that's going to open up a closed or fibrotic fallopian tube. So that is one. If it is a scar tissue, like after multiple abortions or like in Asherman's and this thing, IVF will only help you to implant the, the fertilized egg, but the bed, the growing environment for that is not, how do I put it? It's not conducive. By using either fat or exosomes or PRP, the blood, you can soften the scar tissue in the womb. You can prevent, if it's being lysed, cut off, you can prevent the formation of new scar tissue, making the womb ready to accept anything implanted in it. So they work hand in hand. That is one. But if the person is just not able to, if everything is normal, tube is normal, the lining is a little bit okay, and they are not producing their own egg, then genetic medicine can help the ovary to produce quality egg, even by doing some intravenous treatment or target organ delivery, and that person will naturally be able to produce their own eggs and then become fertile. So it depends on the cause, but regenerative medicine has a place, a role in every infertility situation, except when it has to do with closure, physical structure. Regenerative medicine is not going to open up the hole. Then you're going to need to intervene, But I think IVF and regenerative medicine will complement each other.
All right. So, thank you. The other question, which you have mentioned, is how affordable, and we've spoken about how it's even now more affordable than ever before, at least for us in Nigeria. Same quality, same products, but we have that concession from the producers. So we mentioned that. So the next question is about I know we've spoken about chronic kidney disease, but person wants more information. So maybe um, how long, can someone with chronic kidney disease expect before they get back their normal kidney function? What is practical to expect for someone with CKD?
Okay. If anybody with chronic kidney disease, like I said, the word chronic, during the presentation I mentioned, anything acute is, is easy to treat. If under normal condition, if the circumstances are being controlled that is leading to that person's chronic kidney disease, they need to consistently, at interval of average of 3 months, get the regular dosage of their treatment, which is in most cases, if they're using biologics, that'd be like 3 tiny bottles of umbilical stem cells. Or if they decide to do target organ delivery, they have to do it every 3 months. So they have to do it consistently so that the effect is going to be additive. Then they can, just like fertilizing a plant, you have to consistently keep fertilizing it. Just like the spinal cord injury, the second to last video that I showed, it took 9 months for the boy to move his right hand, 12 months to move the left hand, but he was getting treatment every 3 months without a break, every 3 months. So for chronic kidney disease, the goal is to give incremental improvement. It's not to take somebody from dialysis to 100% normal functioning. And if somebody is on stage 4 or stage 5, is to over time, if they do consistently, you are looking at like 6-9 months, so that their kidney will have been gradually continue to regenerate. And also in that kind of case, you don't want anything to reverse the effect. There are many causes of chronic kidney disease. It could be autoimmune. If it is autoimmune, the person, that means the body attacking itself, the person will probably just in a few sessions within a short period of time get improvement. If it is blood pressure that is high, the blood pressure will be causing damage slowly, gradually to the kidneys. You need to have the blood pressure well controlled, And some people even have narrowing of blood, the artery that supply the blood, which increase the blood pressure. You have to put a stent, keep that open. You need a good health environment. Avoid taking medications that can damage the kidney, because that will be turning the clock backwards. Anytime the kidney is trying to regenerate, if you do anything medication-wise or blood pressure-wise or toxins, anything that can damage the kidney, it will be reversing the regeneration. It's like putting back to square one. So it is possible, but it takes longer. Like I said again, the brain, the spinal cord, and the kidney, they always take multiple treatment sessions, but everybody responds differently. So how many treatment sessions for a chronic kidney? We'll be looking at maybe average of 4. It can be as well as even 8. But again, even if you do 8 treatment sessions, there's no guarantee that your kidney will be 100% functional. But you might move from stage 4 maybe to stage 2, or stage 5 maybe to stage 3 or 4. So you get that improvement. But there's still going to be some scar tissue from the damage. So therefore, you cannot get 100% restoration of function. Over to you.
Okay. This question is about short-sightedness in a boy, 15-year-old. Can they benefit from any of these therapies?
If it has to do with the lens, the lens that is in the eye that help the picture to converge. The lens is so thick. We've not known any body. I don't know anybody that has written an article of getting improvement. But if it has to do with other things, with the structure of the eye, people get improvement. A good example is our multiple sclerosis patient who has a short video on our social media about 3 weeks ago sent me a text from nowhere that our color vision is very sharp, it's sharper than before, back to normal, and it was blurry since 2016 when it was diagnosed. She got treatment in November 2020 when I was in Nigeria. And then a blurry vision, color vision of 2026. Now, about 6 months after the treatment, is now sharp, back to normal. So, yeah, but again, multiple sclerosis is an autoimmune disease condition. So, she got improvement. So, yes, it all depends on the cause.
Thank you. And I think we should also add, we're speaking about the need for multiple treatments sometimes. She also came back for a second treatment, even, so it was after the second treatment that she achieved this milestone.
Yes.
Am I correct, sir?
You are very, very correct. And she's going to get another treatment when I get to Nigeria. Again, multiple sclerosis is an autoimmune disorder that affects the brain and the spinal cord. It has to do with nerves. And like I've said, if you're a kidney patient or you have any issue related to the brain and your spinal cord and is already going for some time, you need more than one treatment session. Please remember that. Don't do one treatment and you want to go to the mountain. And I'm not saying that cannot happen, don't get me wrong, okay? But let's be, medical wise, you need more than one treatment.
This person is asking about Abuja clients. We mentioned remote. We mentioned talked about remotely based people. Person is asking about cost of registration and consultation. You can please contact the clinic for that. You can do that during the working hours.
You can tell them the registration and consultation. So if they're interested, they will call. I mean, if you want to consult with you, they consult with me. There's a fee. It's not a. Okay.
So registration is 10,000 naira, and consultation with Dr. David is 50,000 naira. But as we said, you can talk with me. Inquiry, you don't won't charge anything for that.
Yes.
So okay, I think we've answered this. This person joined late, but he wants to know, or he wants to know if we can treat spinal cord injury. Yes, there was even a demonstration of someone we treated for spinal cord injury, and we mentioned it just now again. Okay, this person is talking about a baby of about 2 years old, diagnosed of cerebral atrophy. That's exactly the way the person put it.
Okay.
Can she be treated with exosomes or adult stem cells? She's having developmental delays, and at 1 year and 10 months, she cannot sit without support. She cannot walk. What are her chances of meeting her milestones after treatment?
Yes, that person, because it is cerebral palsy, that person can be treated. Cerebral palsy happens when there's a deficient of oxygen to the brain, whether it is caused by jaundice or the stress during the delivery or whatever be the case. So there has been a damage to the brain. The person can be treated as long as they are more than 1 year, 6 months, 1.5 years. Okay. If it is autism, you need to have a diagnosis. And there's MRI is going to be normal. Most blood tests will be normal. So for autism, you have to be more than 3 years old. In America, nobody's going to put a diagnosis of autism until the baby is 3 years and above. So therefore, we are not going to treat anybody for autism more than 3 years old. But for things like cerebral atrophy, it's a cerebral palsy, developmental delay, that there's evidence on the MRI. There's evidence on the MRI of the brain, of the damage. So we already know what we are dealing with. As early as 1.5 years, treatment can be done. In autism, you don't see any abnormality. Everything's normal. And the MRI will be normal. So we just can't treat you until you are 3 years and above. You can't treat the kid. I mentioned a child from Canada, Dravet syndrome, and although I didn't post it, they came about 3 weeks ago from Canada. The baby also has 6 years old, developmental delay. Now, in less than 3 weeks, the baby is already responding to his name. When you talk to the baby, look back at you. When you leave the baby alone, she now wants attention. She wants to make sure somebody is around. She's now aware. She's cognizant of her environment. This is what exosomes or stem cell can do, to help in accelerating the healing process in developmental delay. So over to you.
Right. This question is, how many times can someone with a kidney disease get target organ delivery?
Okay. Whether it is target organ or through the vein, it really doesn't matter, but the treatment has to be done every average of every 3 months. And like I said, the number of treatments is average of 4. It could be as high as 8. It just depends on how each individual body responds. So treatment can be done. Evidence have been, I believe the spinal cord injury kit, we did 8 or 9 treatment sessions every 3 months, So we just need to continue stimulating regeneration, because some conditions are just stubborn, or it takes time for the new cells to grow. So they can have as many as possible, because the amount of dye that is used in target organ is very, very small. We use less than 10 ml, and we have to use up to 100 ml to be worried about the dye damaging the kidney. Although in medicine, nothing is 100% guaranteed. So in as much as evidence says you need 100 ml before you get worried about the dye damaging the kidney, some people may be very, very sensitive, and that 10 ml may have a little effect on their kidney. You just can't guarantee. But we go with average, which means 10 or less than 20 ml is safe.
Thank you, sir. Just a minute. So, how long after the procedure for, Asherman syndrome can the woman proceed to get IVF?
Okay. The womb, or the what do you call it? The IVF centers, they have a protocol when you need to take certain hormones and everything. Once the either PRP, exosome, whatever is being used, is being injected, if it is directly into the lining of the wombs, it takes average of 3 weeks for connective tissue, 21 days, for connective tissue to start forming. So anything from 1 month, the person can, get their IVF. But they probably won't be able to get it right away, because, like I said, the IVF centers, they have some hormones that the patient will have to take, and over a certain period before the implantation is done. So by the time they get to the time of implantation, it's already more than 1 month anyway from the time they had their treatment. So they can just start both at the same time, and by the time they're ready for implantation, it will have passed 21 days. So anything after 1 month, they can get implantation.
Someone is asking about statistics on success rates in treatment of high blood pressure and diabetes mellitus.
Okay. On the website of Mayo Clinic, they claim 75 to 80% success rate in most of their procedures. For our own patients treating diabetes, if to control the sugar, there is nobody since I've been doing this that we've not been able to control the hemoglobin A1C, bringing it down. Where there is challenge is totally getting off diabetic medications. There's another testimony I did not even put. I treated someone for back pain and anti-aging in November. The blood pressure medication, she has cut it down to once a day from twice a day. The diabetic medication, she has cut it down to once a day from twice a day. Our sugar readings are between 90s and 120s. This is number that could go as high as 240 before. She had, I believe, she probably had a triple dose of fat-derived stem cells. On our social media, there's a lady that is off diabetic medication. She got only one treatment. She got double dose fat-derived, but she was diagnosed of diabetics about 5-6 months prior to the treatment. That means the pancreas was just giving up. Stem cells was able to reverse it. I have other patients that have had diabetes for many years, and their sugar get controlled, but they can't get off. They are not off diabetic medication. Actually, I have one particular patient that I've treated, I think, 2 or 3 times with fat and target organ delivery of umbilical cord stem cells. Diabetic controlled, and sexual drive, excellent. Everything is great, energy, focusing. But what he wants is to be off diabetic medications. And we couldn't achieve that with those 2 treatments for him. We still plan to do another one when I get to Nigeria in a couple of weeks, to see if he will respond. So my point is, for me, bringing the sugar controlled is 100% result, but it's not going to be 100% for everybody, but getting patient off the diabetic medication, a lot of factors are involved. How old is your diabetics? How long have you been diabetic? It is easier, like I said again at the summary, whatever your condition is, the earlier, the better. Then the earlier, the less number of treatment sessions. Then the earlier you get treated, the less expensive it is. So it's still the same concept. And I hope I answered that person's question.
Thank you, sir. The next question is: can this help treat a child with Down syndrome?
Okay. I've never treated one before, but there's a doctor in Florida who has a child with Down syndrome. He has treated his daughter with umbilical cord stem cell twice. And it was reported that by him, because I spoke to him once, the child, improve in symptoms. Remember, it helps to regenerate. This treatment helps the body to repair, regenerate itself. The challenge is that it's not to cure Down syndrome. Down syndrome is a chromosomal disease. Okay, so regenerative medicine is not going to get rid of that. There's a particular gene therapy going on whereby they will target the damaged gene, remove it, replace it with the normal gene, and the body will be whole. That's in research. That's even planned for sickle cell disease. That is any of this disease that has something to do with the chromosome or DNA or whatever. The gene therapy is in research stage to help to do that. But for the same, those kind of conditions like Down syndrome, there's a abnormal development. Regenerative medicine can help some teens to regenerate and work, improve in the right way, but not to change the DNA or not to change the chromosome problem or not to cure them. So if the person just wants some improvement and they have the resources, no problem. But if somebody that is even struggling to pay their rent or maintain their lifestyle, and they still also want to do everything from their child, I don't think it will worth spending that amount of money, because the gratification, I mean, if you go through a lot to get the money for the treatment and what you're going to get doesn't give you a wow effect, then I will not advise it. I don't know who's asking. I don't know your financial situation, but I'm just letting you know. If you are going to be satisfied, just some little improvement, depending on which symptoms changes, you may try it. Again, regenerative medicine, this treatment does not know the diagnosis. Remember that. They just tell the body to try to repair itself, and it's not an answer to everything or all diseases. And I have not treated Down syndrome before, but regardless, whether it's Down syndrome or it is autism, it's still the same way I'm going to treat them. There's no difference. Okay? So over to you.
Thank you. Our time is fast spent. I want to. It's already 8 p.m. There are some
Wow.
questions there that
I'm going to have to show. Why don't you scroll through? Some of them have been answered. If anyone says that they joined late, and then since you mentioned that, then all my answers, we have to be yes, no, no, yes, and then they can call to find out why I say yes or yes, no. So to make sure that, we take care of everybody.
correct. Thank you. Someone wants to know if it can help to treat a child that is flat-footed.
The answer is no. That's a structural problem. It's not going to make something flat to become hacked. No.
Okay. Can a pregnant woman that is diabetic, so our pregnancy is the factor that this is asking about, can the person get stem cell therapy?
If you are pregnant, why don't you just have to wait? You have to wait, deliver the baby, keep your pregnancy during the diabetes during pregnancy is not going to kill you if the sugars were controlled. Why risk exposing the child unless it's your own fat? And then again, you have to have liposuction. So again, the summary is your diabetic, your pregnancy-induced diabetic can be treated, but after delivery.
Someone is asking again, maybe she joined late, about cancer treatment. The answer is it's possible. I mean, there's research going on presently. We don't have it yet in our own center here.
Correct.
But possibly in the future we may have it. And so someone is hopeful about the future. That what are the chances that we can extend it to teaching young Nigerian students about this, even to the extent of setting up institutions to do that? That's a social question. So please, what's the answer to that?
Well, we're planning on that. I've been working on getting, teaching is one thing, to be able to get the treatment to many people that need it, the supplies and everything. I'm talking to some company here. And even there are some professors and dean of medical colleges that, they're my friends. We're working to see how this can be, get knowledge passed to future doctors. Because whether we like it or not, even though the old doctors are going to tell you it doesn't work, it's a scam, it's a blah, 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 this regenerative medicine is the future of medicine that is available now. You've seen what I presented to you. We make impossible possible. So people will have to agree with it, whether we like it or not. So yes, there are plans. The person can keep in touch with us, and they will follow us on social media. Once anything is new, they will know as long as they follow us on social media.
Now, this is a very interesting question here, very important question, because we've said that we cannot treat sickle cell with their own, we don't treat sickle cell yet.
Yes.
The complications like avascular necrosis, arthritis of the hips and knees, stiffness of joints. The person is asking, do I need a donor for this kind of treatment?
No. Your blood can be used. In sickle cell disease, it is the red blood cells that is affected, not the platelets. The hemoglobin, blah, blah. So my point is the platelets is what we need to treat any of the complications, or the umbilical cord from a donor, or from exosomes. Most sickle cells don't have fat, but if they do, you can even use their fat. Complications can be treated. But the problem is this: if a crisis causes kidney problem, lung problem, arthritis, the chances are, even if you repair, you regenerate, the person have to keep themselves hydrated well to prevent future crisis. Otherwise, you're going to turn around and damage that knee again, Over to you.
So the person also asks if their symptoms, the arthritis, several joints activated one by one, or the worst parts alone.
Yeah, that's a good question. Since if the arthritis are due to sickle cell crisis, they have to be treated one by one. If arthritis a lot of arthritis is due to autoimmune disorder like rheumatoid arthritis, you have to treat them through the vein to tone down, modulate the immune disorder. But you also treat the worst arthritis one by one in those rheumatoid arthritis, just to give the patient better, faster relief. But what is important in rheumatoid arthritis is the systemic overall treatment, not the individual. Whereas in osteoarthritis, you treat the individual. In sickle cell induced, you still have to treat the individual, because individual joints, because it's not the autoimmune disorder process. Over to you.
All right. Someone is asking how many treatments they will need for erectile dysfunction.
Okay. All the erectile dysfunction improvement, about 3 or 4 that are presented, they're all single treatment. Some of them are just fat only. Some are fat plus stem cell. Sorry, some are blood only. Some are blood plus stem cell from the fat. With Africans or African Americans, to see results, it takes longer. So the expectation I push instead of 3 months, I would say 4 to 6 months. And some people will need 2 or 3. We have this treatment now way more affordable. But also, if you're going to go with the affordable one, you're going to need just plan to do 3 sessions. That's my, advice. If you're going to, we still have, even though I like to use car, even though we have Toyota Camry, Toyota Corolla now, we still have some treatments that are Ferrari. So with those ones that are more expensive, you probably need just 1 treatment, or maybe at most 2 sessions. So that person, the answer is 1 to 3 sessions, depending on which package you go for during your consultation.
Thank you. How about neuropathic pain and numbness on the soles of the feet in a 70-plus-year-old?
Okay. There are many causes of neuropathic pain. One, if it is diabetic, diabetic neuropathy, the diabetes has to be controlled. If it's idiopathic, that is, you don't know the cause, or if it has to do with some nerve degeneration, we can treat such patients. They will get improvement because, again, it's related to nerves. Anything that has to do with nerves needs more than one treatment session. So, and it takes time for the nerve to regenerate. So it can help, but that person within, they will just, after the first treatment, if they are happy, then they say, you know what, it's working for me. I want to go for second treatment. And it's going to take average of 3 to 4 or even 6 months for them to be able to know where they are, especially with all these nerves. Nerves takes time to regenerate. And that is why in medicine, they told us that if you are paralyzed, if you are old stroke or whatever, you don't come back, no improvement. Regenerative medicine can reverse things, but it takes time to even make the effect noticeable.
So those are all the questions, and we've addressed every single one.
Okay. I remember some
Those are
people
related to
raising their hands. I don't know if they still have the hand raised.
even the ones in the chat section. I've gone through everything.
Okay, awesome.
The only question that I skipped is not related to this topic, but the person is asking about what is a dye in interventional radiology for target organ delivery. So maybe just general education.
Okay. What is the what?
A dye for target organ delivery.
Oh, okay. What's the dye? I don't know the dye because I'm not a intervention radiologist.
I guess they want to know the
That-
purpose of the dye. What's it used for?
Okay. I mean, when you do an image, you need to know where your wire is. The purpose of the dye is for you to, on the X-ray, the dye will highlight the wire that you put inside so that you know the tip, you know how far, which organ the wire is going to. So that helps you to see it's just like when you are doing injection, we call it image guidance. We use sonogram to guide your needle to see where you are going. So you need to see where the wire you are putting is. Of course, use an X-ray screen to see the wire in the body of the patient, but the dye highlights the end of that wire so you can see it better.
Thank you very much, sir. So I want to thank our audience for joining us tonight. It's been wonderful. Want to assure you that you are amongst the very few privileged Nigerians to be aware of these possibilities. We need to do much more in educating our people, in Nigeria, that these possibilities are already here with us. By the time the world is catching up with this, I mean, some of us have gone very far in these possibilities. So we just keep watching. We have friends, family that need help.
Sorry, Doc. Sorry to cut you short. I have two people that raise their hands, and I think one is in UK and one is in Nigeria. I want to allow them to talk,
Okay.
So that they can probably ask questions.
Okay.
I hope this works. Okay. I'm not sure if Professor Akinsho, there you
go. Good evening, good afternoon, wherever you are. Nice listening to the talk. My question is to know your success rate on the diabetes and the high blood pressure patients.
Okay. Yes, I spoke on that recently. With controlling the sugar rate, bringing down the hemoglobin A1C, and then helping the body to control the sugar better. For me, I've had 100%
Okay.
success rate. But on Mayo Clinic USA website, for their own procedures, whether including arthritis, everything, they rate the success rate at 25 to 80%. Now, that being said, the places where I have challenge is patients that I need to get off diabetic medications.
Yeah.
I have people have all of them lower their dosage, all of them from twice a day to 1 day, sugar control, everything is controlled. But on the other hand, too, these are all just one-time treatments. So in order to get somebody off, they need more than one treatment session, because they have to keep regenerating. Is something that has been damaged for a long time. You have to keep stimulating it, regenerating the cells. That being said, I've treated the patient twice, and everything is great, except it still cannot get off the medication. So when I come to Nigeria, I'm going to be doing another treatment session. Now, on the other,
Sorry, let me get you right. You have not been able to take them off their medications?
that particular patient, oh, I have a patient, that's what I was going to say when I said on the other hand. I have patients, for example, on my social media, I have a patient that gave me video testimonial. She did one treatment using her own fat. She was diagnosed of diabetics. Her sugar, came down. Hemoglobin A1C became normal, and her doctor took her off her medication within 2 months after the treatment. And a year after, she still, as of November, that was a year when she did the video for me, November 2020. She's still not back on her medication.
Okay, will you say that with even the treatment, the patient too must also be careful with their diet and as well as exercise?
That is correct. In some conditions, it's not just get the treatment and go and do what you like.
Okay.
For example, somebody has acute stroke. Once you reverse it, the brain cells did not die. They just need to continue to avoid whatever triggered the stroke, and they move on with their life. But things like diabetics, even if your sugar is controlled at that 2 months that they took this patient off, the pancreas is not fully regenerated. It's still going to take like 6 months to reach that minimum of 6 months to reach that full regeneration. So the patient still needs to continue to watch what they eat, exercise if needed, be active, no sedentary life, do the basic stuff. The stem cell treatment just help to accelerate the healing process, and in some cases to stop progression of some conditions. Like in multiple sclerosis, for example, the medications we give is to slow down the progression of this multiple sclerosis. It does not reverse multiple sclerosis. What stem cell does in studies that have been published is that not only does it abort or stop the progression, it tries to reverse and make the myelin sheath, which is the envelope around for those non-doctors, the envelope around the nerves that have been damaged or attacked by the body, to start repairing, regenerating itself. So it's only regenerative medicine that has been able to reverse the multiple sclerosis, while all the approved orthodox medicine just try to stabilize or prevent the progression of the disease.
Okay, thank you. I appreciate it.
Thanks. Now, I have one person, I guess might be in UK. I'm going to allow you to talk. Over to you.
Yeah, good evening, doctor.
Yeah, good evening.
Yeah, I appreciate you so much. Although I'm in Nigeria, that's my surname, an acronym for my surname.
Okay.
All right. So I have a 3+ baby boy who was diagnosed with CP at the time. So initially he had a surgery for adenoids and tonsillitis, so which wasn't detected on time. So we feel that's what caused him to go into the CP. So and right now he's doing better. He's undergoing physiotherapy, so he can walk now, but not fluent in walking, and in speech too. He can only say just one word for now, which is just bye bye. So I don't know. And I listened carefully. You mentioned the MRI not being able to capture autism, because the MRI, that's where we saw the adenoids and the tonsillitis before we went for the surgery. So I don't know. I want to find out how this stem cell therapy can come in, and is there any follow up we need to do before we come over for the stem therapy?
Okay.
Thank you.
Yes. Thanks for the question. Just I have one or two questions for you.
Okay,
The
sir.
MRI, you saw the adenoids. Did
Yes.
the MRI capture the brain section?
Yes, it did.
What did they say they find?
They said everything was fine.
Okay. How can you diagnose CP? Well, it's not a question for you anyway. Without knowing you probably have read about CP. You understand
Yeah.
that there's
Yes.
damage to a section of the brain.
Yes.
So if there's a damage, the MRI has to pick it up. If it means they have to use a thin slice, because it's thin slice, that is, instead of going from here to here and then to there, then you go a little to capture every section, of the brain. There has to be pathology on the brain if you have cerebral palsy.
Okay.
Like I said earlier, autism, you find nothing, but cerebral. Well, anyway, to answer your question, you have to find a pediatric neurologist or a developmental delay specialist, pediatrician, or
Is it
anybody.
occupational therapist?
No, not occupational therapist. You need a physician, a pediatrician or pediatric neurologist to help you do the workup. And if the neurologist, from their own experience, decide that clinically, even though the MRI is normal, that clinically they still strongly believe it is CP, that is fine. What is important is the child is more than 3 years old. And even if it is autism, remember I said earlier, you have to be 3 years old for me to even consider treating you. So if there's no image evidence like MRI of CP, and it is clinical diagnosis from the neurologist, that is fine. What is I am not a pediatrician, so I refuse to diagnose children. Otherwise, for me, it becomes conflict of interest. It becomes like, because I want you to treat your child for, say, CP or autism, that's why I'm labeling your child with that diagnosis so that I can come and get regenerative medicine treatment from me. So I purposely decided that I am not going to be putting diagnosis for children. Let the neurologist, the pediatric neurologist or the pediatrician, let them do the workup. Once they give you official report, it doesn't matter to me what they call it. Like I said, it is still going to be the same treatment for both autism and the CP. So whether we got the diagnosis right or we got it wrong, it does not matter. The stem cells go into action and they help the body to repair itself. So yes, get official report. official diagnosis of whatever they end up with. But if the MRI was done a long time ago, over a year, I will still advise you try and update the MRI, then take it to them to give you a report. And after that, you can reach us for consultation. I'm going to be in Nigeria for 5 weeks. I'll be there in a couple of weeks' time, and then so. And if I'm not around, Dr. Kolawole can take care of you.
Okay, thank you so much.
Yes.
So we thank everybody again for joining us today, and so just keep watching. Follow us on social media. Keep your eye on our work. If you have questions for your friends, your family members, or even your own selves, call us. If we can help, we'll let you know. If we can't help, we'll let you know as well. We'll be transparent.
Yes.
So thank you very much. David, thank you again for a wonderful session tonight. Fu and I have been further educated on these topics. And we thank our technical team as well for making it smooth for us today. So thank you, everybody.
Thanks. Yeah, thank you all. Thanks for watching. And we're glad to have you. And we promise we continue to still fight for more discounts from these European countries to help us in Africa. Have a nice evening and a wonderful week ahead. Bye.
So let's listen to the case studies.
My name is David Ikudayisi, a US board certified internist and regenerative medicine. Welcome to Glory World.